When did formula feeding become the norm and breastfeeding the exception? Almost everyone can breastfeed, and it has been the way of providing nutrition for our children since the beginning of time. Why now do people find breastfeeding offensive? It is the most natural and most nutritious choice for every infant. Two military women were recently disciplined for posing for a photograph while breastfeeding their children while in uniform. The woman who took the picture was fired from her job, and the pictures were taken to support a national campaign for breastfeeding awareness. Also recently, a woman was photographed on the cover of Time magazine while breastfeeding her 3-year-old child. Many people found this picture to be offensive and claimed it as child molestation. The cover was shot in order, again, to raise awareness that breastfeeding is normal and natural. Society has portrayed breasts as a sexual object and the desire of many. This can be seen on any magazine, commercial, television show, or movie. But when they're viewed for their actual purpose, many people become very offended and appalled. This negative portrayal is sometimes the reason why mothers choose not to breastfeed. Today, I will discuss breastfeeding in hope of raising awareness to the benefits for the mother and the infant, the World Health Organization recommendations, and the harmful side effects of formula feeding. I will begin by telling you about the benefits of breastfeeding. Breastfeeding not only benefits the child, but the mother as well. For the mother, it helps promote instant bonding. It does not cost anything. It helps her uterus contract and prevents the risk of serious postpartum hemorrhages. It helps the mother's body return to the pre-pregnancy shape and size, and mothers who breastfeed have a decreased risk of postpartum depression, breast cancer, ovarian cancer, and type 2 diabetes. For the child, exclusive breastfeeding is the healthiest option for the newborn. According to Porth and Maffin, infants receive all of the essential nutrients and antibodies through the mother's breast milk, which decreases the chance of an infant contracting infectious diseases. Breast milk is readily available and easy for the infant to digest. This helps decrease the incidence of colic and other digestive problems. According to the American Academy of Pediatrics, breastfeeding can help prevent sudden infant death syndrome as well. Now I'll tell you about some of the World Health Organization recommendations for breastfeeding. According to the World Health Organization, exclusive breastfeeding for 6 months is the optimal way of feeding infants. Thereafter, infants should receive complementary foods with continued breastfeeding for up to 2 years of age or beyond. The World Health Organization has initiated the Baby Friendly Hospital Initiative in order to promote hospitals to support breastfeeding. The Baby Friendly Hospital is encouraged to have lactation counselors available to aid in the breastfeeding process at all times. Skin-to-skin contact within the first hour after birth is essential in initiating the breastfeeding experience. Skin-to-skin contact stabilizes the baby's temperature, heart rate, and helps soothe the infant. The World Health Organization's goal works to encourage parents and provide adequate support for breastfeeding. Finally, let's discuss the ill effects of formula feeding infants. Formula companies do not inform consumers about the potential side effects. Children who are formula fed are at an increased risk of developing infections, allergies, chronic diseases, and obesity, according to the World Health Organization. Infant formula is frequently recalled due to contamination. Powdered infant formula is easily susceptible to contamination because it's not packaged as a sterile product. To prevent feeding the infant contaminated formula, the care provider should prepare only one bottle at a time. The bottle should be sterilized and boiling water should be used to mix the powder in it. The bottle then should be cooled and fed to the infant. Preparation of formula can be a time-consuming and stressful time for the mother and the infant. Bottle-fed babies are often overfed, and this is sometimes evidenced by frequent episodes of spitting up. Today, I have talked about how breastfeeding is the best choice of nutrition for infants. In conclusion, breastfeeding is a wonderful way for mom and baby to form bonds, provide essential nutrients, and pave the way for a healthier future for the infant. I hope that breastfeeding will once again become the norm and women will not feel discriminated against for breastfeeding their children.